Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Alexis Duke, a dermatologist at Duke Neal Dermatology and Terrebonne General. Since May is Melanoma Skin Cancer Detection and Prevention Month, today we'll be discussing how to care for your skin properly and detect skin abnormalities. Welcome to the show, Dr. Duke.
Thank you so much for having me, Rhonda.
All right, well, let's get started with you telling us a little bit more about your role as a dermatologist.
Okay, my name is Dr. Alexis Duke. I'm a board-certified dermatologist that works at Duke Neal Dermatology in Homa. I'm a general dermatologist who has a special interest in medical dermatology, which is how internal disease affects the hair, the skin, and the nails. And I have a practice that's very heavy with skin cancer screening and prevention.
Okay, and how long have you been practicing dermatology and what drew you to it?
So I've been practicing for 15 years if you count my residency, and I love dermatology because it's a mix of different medical specialties. It's internal medicine, it's surgery, it's pathology, which is the abnormal cells underneath the microscope. So it kind of encompasses a lot of different things in medicine.
Okay, and what is your recommendation about how often someone should get a full body cancer screening and what age should they start?
Okay, so I would say for most people, we want to do it once per year, starting at about age 20.
Okay, and what are the most common warning signs of melanoma or any other type of skin cancer?
Okay, so there's a mnemonic that I try to teach my patients called the ABCDEs of melanoma. A stands for asymmetry. So if you take a lesion and you draw an imaginary line down the middle of it, it should be mirror images on both sides to be symmetric. If it's not, then it's asymmetric, and that could be a potential warning sign. B stands for border irregularity. So anything that has a jagged edge or a streaking edge, anything that's not smooth along the edge. C stands for color. So I think we all know about brown and black for melanoma, but melanoma can also be amelanotic, which means that it can be flesh colored, pink, red, white, or have a blue-gray coloration to it. D is diameter, so how big is the lesion? Anything over about 6 millimeters or the size of a pencil eraser should arouse suspicion. E is evolution. So is that lesion changing? Is it changing size, color, and shape? Is it symptomatic and it never was? So is it itching? Is it bleeding or forming a sore on its own? Is it swelling or tender and it never was? And E also stands for elevation. So anything that is raising from the skin could be a potential sign of skin cancer.
Okay, and what are the most common warning signs of melanoma or skin cancer?
So kind of what we just talked about, those any lesion that's changing. So something that may have two colors, a sore that's bleeding and not healing. Those are typically the signs.
Okay, and how can patients perform a self-exam if they need to do that on their skin, and what should they be looking for?
Right. So they should be looking for kind of what we were just talking about, any lesions that meet those criteria, the A, B, C, D, Es, a red scaly patch, a sore that's not healing, a wart-like growth, all of those could be potential skin cancers. We usually recommend doing skin screens once per month. And so what you're going to want to do, you're going to have your clothes off. I usually tell people after the bath or shower is the best time to do this. You want to be in a well-lit room with a full-length mirror, and you also want to have a handheld mirror, and you're going to check your skin everywhere from the top of your scalp all the way to the bottom of your feet. And basically you can do it in sections. We usually say you want to check your face, neck, chest, abdomen, axilla, backs of the arms, the top of the hand, palms, between fingers, underneath fingernails. Then you go down to lower body. You're going to check both sides of the thigh, the shin, calf, top of the foot, between the toes, under toenails, soles. And then you're going to check your buttocks, genitalia. And finally, you're going to end with your back, the back of your neck, your ears, and your scalp. And obviously, if you have someone that can help you, there are certain areas that are easier, such as your scalp, if you have a friend, right? But you can take a comb and kind of move the hair around to see if you can find anything in those areas.
All right, and that would be a thorough exam.
It is a very thorough exam.
What are some effective ways to prevent skin cancer?
So sunscreen. It should be broad spectrum, which means that it's going to prevent or protect you against UVA and UVB rays of the sun. It also should be SPF 30 or higher, and so that's going to protect you from about 97% of the sun's harmful rays, and you want it to be water resistant. You need to be sure that you're using enough sunscreen, and so for the typical adult, usually 1.5 ounces or a shot glass size full full is what you need, and you have to reapply every 2 hours, even if your sunscreen is water resistant. You want to wear photoprotective clothing, so you need to think about wide brim hats, sunglasses, long sleeve shirts that have a tighter weave. You can always seek shade when you're outside, and you want to avoid, if you can, the times of peak UV radiation, which is usually between about 10 o'clock in the morning and 3 o'clock in the afternoon.
Okay. Is it ever too late to start practicing good skin protection?
No. You may not be able to reverse damage that's been done, but you can absolutely prevent new damage from happening.
Okay. And what advice do you have for patients who are concerned about skin cancer, but they're hesitant to can talk to their physician?
Right. So I always tell patients, you are your best advocate, right? And so you definitely need to take control and do something. For some of these skin cancers, early detection may just mean that you have a smaller surgery spot and a smaller cosmetic scar. For others, it's literally the difference between life and death. And so if there's something that you're concerned about, you absolutely need to get it checked out.
Okay. And tell us about some skincare procedures that you offer at your office.
Okay. So like I said, I do mostly medical dermatology. So we do a lot of skin cancer checks. We do a lot of skin cancer procedures, so removal of skin cancers. We do things like acne, rosacea, psoriasis, eczema, different rashes. We also do some cosmetic dermatology. So we do things like Botox, Dysport. We do soft tissue fillers, and we also have laser services at our office.
Okay. And how can people schedule a skincare consult with you?
So they can give us a call at Duke Neal Dermatology, 985-868-1810, and they can ask for Dr. Duke, and one of the schedulers will be happy to assist them.
All right. Well, thank you so much for sharing this valuable information.
Thank you.
For more information about proper skincare and detection, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alford, and I'll see you right back here next week.